Hi there, welcome to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize. Thank you for joining me today. This week, we're continuing the conversation on screening tests, and more specifically, STI or sexually transmitted infection testing. Many people shy away from this conversation, but it is a key part of your health care. Testing is recommended for all sexually active individuals, young and old. Many people say they are not active because they have not had sex in a week, a month, or maybe even a couple months. My general rule is that if you have had a sexual partner in the past year and have not been tested, then you should be tested. If you are a young person, a teenager, just experimenting, you should be tested. If you are living in an assisted living facility or living out the golden years of your life, but you're still enjoying yourself, you should be tested. We recommend testing for gonorrhea, chlamydia, hepatitis C, and HIV. If you are in a high-risk population or engaging in high-risk sexual behavior, such as unprotected sexual intercourse while having more than one partner, not necessarily at the same time, in other words, not in a long-term monogamous one-partner relationship, or you are exchanging sex for anything else such as drugs, money, or housing, you should also be tested for syphilis and hepatitis B. One specific test that I want to touch on, as many patients request this, is the testing for herpes. Herpes is not a recommended test at screening. Studies have shown that in the 14 to 49-year-old age group, 1 in 6 people have genital herpes caused by herpes simplex virus type 1 or 2. A study at Hopkins reports that 50 to 80% of the population have HSV type 1, which is typically associated with getting cold sores or fever blisters. Because of its prevalence in the population and the increased incidence of HSV1 causing genital herpes due to oral sex, we typically don't do a screening test, but rather a diagnostic one if you are having concerning symptoms. The takeaway points for today are: gonorrhea, chlamydia, and HIV testing is recommended for all sexually active individuals that are not in long-term monogamous relationships. 2, for any high-risk sexual behavior or high-risk group, we also recommend testing for syphilis and Hep B in addition to the testing that we recommended before. Number 3, herpes simplex type 1 and type 2 can cause genital herpes, and screening is not recommended. However, if you are symptomatic, we recommend diagnostic testing. Visit the CDC website below for more information on STDs. Come back again next week and we'll continue the conversation on our journey to amazing health. To book me for a speaking engagement or to connect with us on social media platforms such as Twitter, Facebook, and Instagram, we are at Amaize Health, or the website www.amaizehealth.com. Be sure to like and subscribe. Again, this is Dr. Thorpe Amaize with Amaize Health. See you next time.